I think there's a couple of reasons why we seem to be in the dark ages for hormone health, and that is where we are. The fear for men about testosterone, a lot of that is around that testosterone causes prostate cancer. And for women, it's that estrogen causes breast cancer. And those have become very firmly held beliefs, slightly delusional. The testosterone causing prostate cancer in men actually was when a really expert urologist in the States went to dig through the archives, found that this was based on one case from the 1930s.
Hello everyone, and welcome to another episode of It's Never About Money. I've known for some time that hormones play a very strong and powerful role in the way that we engage with the world. But what's become increasingly clear is that when hormones are out of balance, whether that be in men or women, it's really difficult to determine whether mental illness is mental illness or it's related, or burnout is burnout or it's related to hormone health. And now arriving at the middle part of my life, my curiosity for hormone health has only deepened, and I was fortunate enough to be connected by one of the amazing members of our community to Dr. Ceri Cashell, a GP and a powerful advocate for hormonal health. Ceri is also the co-founder of Healthy Hormones, a platform educating both patients and clinicians on how hormone shifts, particularly around perimenopause and menopause, can deeply affect well-being, mood, energy, and relationships. Her work helping dismantle decades of misinformation and bringing dignity and clarity to a topic that's long been neglected. This conversation is for anyone who's ever sensed that health underpins everything we care about, our values, our capacity to work, connect with each other, and live meaningfully. And I want to thank those who've already been engaging with me online about this. It's clearly a topic on many people's minds. Let's keep that dialogue going after the episode actually airs. Awareness grows when we share openly and listen deeply to each other. So Ceri, welcome to It's Never About Money. I'm super excited, Ceri, to have a chat to you because, a lot of the time in my private practice when I'm talking to my clients, we're doing the values game, and a lot of them intuitively pick health because it seems like intuitively that health often should come before anything else because it affects so many things. So I'm excited to talk to you specifically about hormone health, which from our brief conversations before is really the kind of foundational sort of building blocks of health. It's so fundamental to everything that we do and decide to do. So what drew you firstly into the world of hormones and hormone health? What was that sort of turning point for you personally?
Yeah, I think that's so correct, that hormones really are like integral, they are foundational in health. And, health should be our number one priority because without your health, you really can't do anything else. You can't enjoy your leisure time. You can't work productively. And for me, I think as a primary care doctor, a GP, I really see people in the whole context of their lives. So they come in as a whole person, and I'm really trying to prevent disease, but also trying to make sure they're living their best version of themselves, in their professional life and in their personal life. And it was a patient 4 to 5 years ago now that came in and said she'd really been transformed by some kind of magic medicine, which for her was testosterone. So this was the first time I'd really encountered a female patient wanting to continue on testosterone in her case, and she'd really felt it had transformed her ability to work and to partner and to parent, and wanted me to learn more so that I could share that transformational medicine with other patients, particularly women in that case. Yeah, it set me off on a voyage of discovery, realized that the very poorly named sex hormones, estrogen, progesterone, and testosterone, they've been gendered. They never should have been gendered. All humans have exactly the same 3 sex hormones, just in different amounts. And they play a critical role in really cellular health. We know that mitochondria, our little battery packs, are covered in estrogen receptors, probably covered in testosterone and progesterone receptors too. And these so-called sex hormones are very active in our brain. So they really determine how we think, how we feel, how we learn, and how we behave, which really is the essence of yourself. So
Mhm.
when they're off kilter, you're just not going to be in optimal condition in whatever it is you're wanting to do.
So, as a GP, with this new kind of found lens that you have and the focus and the specialization, did you often, or do you currently often find that when people come and see you for other things, there's often a sort of suspicion that it could actually be a hormone related issue again? And can you give us some examples of what people can come in to your clinic with, or perceive that they might have, and then end up with an understanding that there's something not quite right with their hormone health?
Yeah, so I think really the key to understanding is that these are not sex hormones. They are just hormones that act on every single system, every single cell in the human body, male and female. So that means when they shift or they decline, it can affect every single system and every single cell. So for both men and women, when hormones do decline, it can impact anything. So everything I can see hormones in every single presentation. I think the big things that are really critical for people are, mental health presentations, looking
Yeah.
at hormone levels there. And certainly for women, it's extremely common as they move through midlife that they will present with psychological symptoms because, all women will lose their estrogen and progesterone at the point of menopause. Men and women testosterone declines probably from the late 20s, 30s, and declines across the life cycle gradually. So men and women both experience this slow decline of testosterone from a peak in our late 20s when we're at our peak performance. And it can drive mental health issues. It can drive metabolic dysfunction, which, is also being compounded by our toxic environment of sitting still, eating fast food, not getting enough sleep, being surrounded by dopamine depleting activities like LED lights or computer screens and phones. So that gaining weight around your middle, maybe becoming a bit insulin resistant, pre-diabetic, affecting your bone density, causing muscle loss, causing fatigue, just not feeling like yourself, like you just aren't firing on all cylinders. And it is really like you've taken the key players out of the game, out of the team, and you're trying to sort of keep going. It's not that you will suddenly keel over and die, but you're just functioning at this lower cellular battery level. It's
Mhm.
okay, but you're just not optimum. And switching up those hormones can really bring people back to a much higher level of health, well-being, as well as preventing, future diseases which might be starting to present themselves.
Quite seems quite sad that someone might actually present with mental issues, and mental illness issues, and then decide that they would move into the ecosystem of looking after themselves by finding a mental health practitioner, only to find that this might be actually born by a physiological issue rather than a psychological issue. And so, all of a sudden, they might not actually be dealing with the root cause of the problem. And I imagine from your perspective that this would be a lot to do with a lack of awareness amongst other medical professionals, not just GPs, but like, mental health professionals and alike.
Yeah, absolutely. I mean, so this is one area where I say there's real health equity in between men and women, is that hormone medicine, when we're talking about these sex hormones, is done equally poorly for both men and women, and it's really absent from medical training. We're not taught about it at medical school. It's not a part of our postgraduate training. Even people who specialize in hormones, endocrinologists, often aren't that confident or comfortable with prescribing sex hormones such as testosterone to men and to women. And it really means you're missing a major part of the biological part of health. When we look at mental health, we've really focused on the psychological aspect, which is important. You've got to look at trauma, you've got to look at what's going on in your life, your boundaries, how you respond to things, and the social aspect. Are you trying to do too much? What are your relationships like? What's your work like? But we also have to remember that we are biological beings, so when things are changing at a cellular level, because of changing chemistry, that drives low mood, anxiety, insomnia, so if we don't address the biological causes, there's no amount of psychological therapy that's going to fix that.
Mhm. Makes sense. I mean, you talk about hormones not just as chemistry, but as identity. Is that what you mean by that? Like literally our identity and our personality, or what we perceive to be our personality, could be driven in a large part by the effectiveness of our hormones, or the ineffectiveness of the hormone levels, right?
Yeah, absolutely. Because, our neurotransmitters in our brain, the four key ones are dopamine, which everybody's heard about. That's your motivation and reward. You're a go-getter. Your serotonin is, you're happy, contented, resilient. GABA is you're chilling out. And glutamate is you're kind of learning, you're on. And they all need to be balanced. And we've got good evidence that the sex hormones, which are really brain hormones, really, allow them to work as a beautiful symphony. And when they're out of whack, then it's bad heavy metal, and you're going to be in this more agitated or more flat state, and that is your personality. So people who run with low hormones, that will really affect your how you behave and how you feel, and that kind of is personality.
Again, it's challenging to think about how we sometimes think about ourselves and our personalities, and then judge aspects that may not be to our liking. And to some extent, it's can be beyond our control if we haven't, you know, completely sort of covered off on this sort of, what we are discussing now as being primary health related issues. Like,
Yeah, I think as humans, I think we can be a bit arrogant about feeling that we're above the biology, we're above the sort of the structure and the
yeah,
chemistry of,
yeah,
and really, yes, there's things that we can very much do. We have free will, we can modify a lot of our behaviors, which, and a lot of that can really drive better health and better hormonal health. But to sort of negate the value of this very basic chemistry, which, does determine what our cells are doing. We are just we're a being that's made up of all of these tiny building blocks, which need adequate communication. So hormones are just chemical messengers that go from one part of the body to the other, telling the destination what to do and when to do it. So it's like cutting the Wi-Fi off, or running on 2G. I don't know if that ever existed, but like we now live in a world we need to be running 5G. We need all the bars.
we
And
do.
when the hormones are down, it's kind of like a wee bit of a average 3G, or it's really, or maybe going back to like analog phone calls, it's slow.
Yeah, makes sense. It's a good analogy, actually. I'm not sure if 2G was ever around, but I know.
But a Nokia.
So, how does hormone health actually influence someone's ability to work, to parent, to show up in a relationship? Because it's never about money. And in a private practice, I often talk about chasing money for money's sake itself is not what people often want to do. There's all these other things. And health seems to be one of the fundamental ones we all innately and intuitively feel. How does health, if you don't have that good health, that good hormonal health, how does that show up in the way that we, interact in our lives, through in family and in our career, that sort of thing?
So what we do see is, because, and again, it goes a lot back to how the hormones will affect your brain health. So if you're running with, for women, they go into these very fluctuating hormone levels, in midlife, but also even in our reproductive years, our hormones change across the cycle, and then your testosterone fluctuates across the 24-hour period of the day. So we have quite different hormonal rhythms, but we do both have rhythms. And when hormones are low, your brain just isn't as switched on. So women particularly do talk a lot about brain fog in perimenopause. And it's a bit of a colloquial term, and really should be called neurocognitive syndrome of perimenopause and menopause. And that's because you don't have the estrogen, progesterone, testosterone in your brain that allows you to focus, to concentrate, to remember, to plan. And also, your mood will shift, so you're not as tolerant. You can be
Mhm.
more irritable. You can lose, and I think men definitely experience this as well, when as testosterone drops. Again, that reduced cognitive ability. but also a loss of self-esteem. Your confidence is down. You're not as prepared to push yourself. So we've got more data on women because we do have this biological transition that all women go through. We've got very hard data that women are reducing their hours, are reducing and leaving the workforce often years before they'd intended, because of ill health, which is certainly in part due to this hormonal transition. And it really affects. That's one of the things that impacts my patients the most, is that they've been doing a job for years. They're accelerating through their career. They're absolutely smashing it. And then suddenly they cannot manage it anymore. And then it's transformational to see when you optimize hormonal health again, they're back on it. They're still doing the multiple things they were doing last year, but they're able to do it again. So you really see that transition of these hormones being regulated in the brain. Your confidence is back, your self-esteem is back. You can remember your words, so you can present at meetings. You can plan tasks, you can negotiate, you're confident. It's really transformational. We don't have the same data looking at that in men, but although we're different, we're very similar. And I have male patients are on testosterone, and they really feel they get that confidence can come back. And testosterone in men is different. We can talk to that a wee bit more. But you do see that switched on confidence coming back. In relationships, for women and men, low testosterone is associated with loss of libido. So that loss of, intimacy with your partner can really devastate relationships. And it's a really important thing to address. It's not just, a recreational lifestyle thing. It's what keeps, intimate partners often in a relationship. As a parent, parenting with hormonal fluctuations or low hormones is challenging. Children are, they're hard work. Like they're probably one of the hardest things you can do. So you need to be on all cylinders if you're going to manage, kids in the house, because they'll try you at every turn. So, really in all those domains of professional and personal life, again, so key to have those all online. And so you can do all those things, at each 24 hours, partner, parent, and, turn up at work.
And if you're one of the people that are driven by money solely, then you would listen to this as well, in the sense that, you could have lost income, burnout, early retirement. All those things are possible if you're not looking after yourself, or not necessarily even looking after yourself, or you're not being aware of what might be going on unnoticed. And so,
But also, even if you're saying as well, if you have to be, although you can optimize hormones, part of that is making sure that you have reasonable physical expectations of, your body, that, if you deprive yourself of sleep, particularly for men, well, and women, but we'll really see falling testosterone levels if you're not getting enough sleep. So always putting your health there alongside your professional work. You can't sleep when you're dead. You need to sleep every night. So there's a real danger in this pursuit of success and, fulfilling yourself at work, that you can really be causing quite a lot of damage to your biological health. And it's really important for younger men and women to recognize that this is not something you can put off. So in your 20s, in your 30s, you've got to really be maintaining this healthy hormone balance, through enough sleep, eating the right nutrition, not drinking alcohol, and building muscle. For both sexes, we should all be at the gym lifting heavy stuff from early on. It's much easier to do it in your 20s and 30s than in your 40s, 50s, 60s, 70s, 80s. And I think that's really important. A lot of people, when they're younger, they feel immortal, but
yeah.
you see the damage, often 5, 10, 15 years later. So you want to really always be investing today in your physical health, the way you do with your finances. You got to invest today to get that return in 10 or 20 years. That compound interest applies to human biology.
Yeah, that makes sense. And we've had a lot of community engagement, on LinkedIn and socials, prior to this episode. And a lot of it is around, we had people asking about perimenopause and menopause, and the hormonal shifts that actually happen under the surface, which you've kind of just addressed. But also the idea of having an overactive or underactive thyroid, and how that can affect autoimmune conditions. Just wondering whether you've got any insights into that.
Oh, yeah. I mean, this is again, in our modern world, a lot of people would refer to it as a toxic soup. So, we live such in a way that is contrary to how we were designed. If the transformation, and not necessarily a good way of modern society compared to where humans evolutionarily are at, we should really still be living in a farm and, getting up when it's daylight, going to bed when it's dark and, moving. Whereas nowadays we live in this very pro-inflammatory environment,
Mm,
inside LED lights, not moving, going to bed too late, too much blue light in the evening, as well as these ultra processed foods. But also the external environment has really changed. We've got higher levels of pollution. We've got, noise pollution, sound pollution, light pollution, and microplastics in the food chain. We know, for instance, that placentas, when you're developing, that there's actually up to 90% of placentas, that like in a baby in utero is living off, have got microplastics in them. So we've disrupted hormones and biology from the get-go. And part of that drives inflammation and autoimmune disease. So we're seeing higher levels of autoimmune disease. We're seeing much higher levels of food allergies, medication sensitivity, because all of that means that our nervous system and our immune system is permanently on high alert. So we release these little inflammatory chemicals all the time, which isn't good. Chronic inflammation is really necessary for healing and fighting off
mm,
infection. You need it to come in bursts. It's really important. But
mm.
when it sits there at this low level all the time, it does drive, a lot of chronic disease, like diabetes, dementia, bone density loss, heart disease, but it also does drive autoimmune disease. So we've got our poor nervous system and immune systems have really been affected by modern living. So we have to really work hard to go against that and get back to what's healthy for us. So, and thyroid disease would be a big, one of the big things that we do see a lot, especially in times of hormonal shift.
And you're suggesting that these pro-inflammatory behaviors and sort of actions that we do take in the society that we're in today are pretty strongly correlated and related to hormone levels and
Yeah, there's some, well, again, very hard to see causality and, as opposed to correlation, but there is, I mean, there's a wonderful graph that I saw last week showing the increase amount of plastics being used and the decrease in male testosterone levels at infertility clinics. So they collect really good population data on testosterone through sort of sperm donation clinics and infertility, and we've seen that decade on decade, you're a man aged 30, the average testosterone has fallen from the 90s to the noughties to now. So we're seeing almost like this almost handmaid's tale change in human hormone levels, which is really quite frightening. And we don't have the same data in women, but we are seeing that our environment is really impacting not just autoimmune disease, but hormonal health, chronic disease. We're seeing this rise in obviously obesity, and there's multiple things happening, but it's all connecting, and a lot of it is driving a lower level of health at a population level.
Mm. So I'm really interested about why we're advanced in so many areas, but we seem not to be too advanced in this specific area. It's almost like we're learning about this now. It seems strange given our conversation that that's the case, but I wonder whether some part of it is relating to the gendered idea of certain hormones being related to male. Testosterone is male and estrogen is female. I wonder whether there's these kind of mythical ideas that are kind of in our narrative that is creating a lack of proper awareness.
Yeah, I think there's a couple of reasons why we seem to be in the dark ages for hormone health, and that is where we are. The fear for men about testosterone, a lot of that is around that testosterone causes prostate cancer. And for women, it's that estrogen causes breast cancer. And those have become very firmly held beliefs, which, slightly delusional. The testosterone causing prostate cancer in men actually was when a really expert urologist in the States went to dig through the archives, found that this was based on one case from the 1930s. So, has really challenged that narrative. And so where, certainly, there is a bit more testosterone prescribing, and testosterone prescribing in men is different to women, because if men, it's really important that men who are worried about the low testosterone are aware that if you use testosterone, you can cause infertility by using high dose. So it is really important that testosterone replacement is done by somebody who knows what they're doing. Uh, uh, Recognizing it's hard to find somebody as well. And there's different ways that you can bring your testosterone up. But yeah, so there's really been this fear about hormones being cancer causing in both genders and both sexes. And the other thing I think does come back to money. I think it is all about money when it comes to hormones. So hormones are naturally occurring substances, so you can't patent their chemical structure. So there's very limited profit for the pharmaceutical industry to make hormones. You can only patent
Ah,
the delivery device. So, and delivery devices are like patches or tablets or gels, but that again, a lot of those delivery devices are off patent. So there's very little profit. There's some, but the companies that make body identical hormones for both genders are small companies. They're quite happy with their market share, but they don't have the money to fund, in general, randomized controlled trials, to really see, like, if we give men testosterone, is it going to reduce, low testosterone, is it going to reduce dementia, is it going to treat osteoporosis, and the same for women. And we've got a medical education system that I think is very much influenced by the pharmaceutical industry. And I can tell you 20 different drugs for high blood pressure and high cholesterol, but I knew nothing about estrogen, progesterone, and testosterone. So I think my training, in a very insidious, subtle way, has been quite influenced by by somebody's profit sheet. And the whole scaremongering around women's hormones and estrogen was at a time when cholesterol and the cholesterol treating drugs, the statin industry was at, really was the biggest selling drug. And the trial that sort of scared women off hormones was designed to see if HRT would reduce heart disease. So I feel there was an agenda there to say that it was dangerous, because that would have really shook the statins market share. So I think a lot of the time, unfortunately, when bad things are happening, it's all about money.
yeah.
And it has really impacted health, and it's really impacted research and our understanding, our education, and our training, and yeah, in terms of hormones,
I know we're
specifically sex
I
hormones.
know we're talking about sort of loose correlations here, but the idea that good hormonal health and having an awareness and having actual, remedies and strategies to kind of prevent or improve outcomes really does seem to relate to the bottom line from an economic perspective. Because, the idea of, like, again, lost income, early retirement, burnout, poor decision making financially, the whole lot of it
Yeah.
really seems to relate. So why wouldn't the government get involved, where private corporates don't see the money in the testosterone production or estrogen production kind of industry? Why would the government actually not get more involved to try to improve this situation?
I feel they don't actually have, I don't think the will is there, or really the understanding.
Yes.
So, I mean, I've spoken to people, who are involved in policy making, and I think there's still an expectation that that's going to happen over there and somebody else is going to sort it out, and it's not really our problem. Even if we look in Australia at our data collection, at what, the cost of disease or what diseases are really impacting people, it's not even broken up a lot of the time in terms of gender. So it's very hard to even get a good handle on how much dementia in women costs the Australian economy. We know that the lost earnings for women retiring early in menopause works out at about 15 billion per year for Australia. And it's likely that the cost of preventable chronic disease just for women is in the range of maybe 40 to 50 billion when we look at dementia, heart disease, and osteoporosis. So it's a huge amount of money, but again, because it is about money, I think governments live very much in the here and now and in their profit balance sheet, and they're not prepared to invest in the policies that would make a huge difference, whether that's increasing sport at school, because that's when we build our bone and our muscle and really can counteract some of the environmental hormonal damage. Better food policy so that, affordable, good food is accessible to everybody. We are influencing our fast food industry, our sugar industry, they're huge. These are massive hormone disruptors in our young population, yet government turns a blind eye to that. So there's huge things that government policy could do that would really start early in somebody's life to optimize their future health well-being, which would absolutely translate into better economic output, never mind, lost earnings and cost of chronic disease, so, but you'd need somebody to really, it's almost like the politics interferes with it. So they're so busy trying to manage the here and now that they don't have the ability, the flexibility, or I think even the ability to go, almost this policy needs to be taken out of politics and let somebody just, have a health czar, which they've looked at in other countries, who says this is what we need if we want to improve the health of our nation and the economic, output of our nation. It needs to be immune from the political will of the day.
Yeah, well, I mean, this whole podcast is about individuals trying to create a subsystem within a system that might not actually work for them. So you've already outlined a number of different things that people can do to try to get themselves in a position with non-pharmacological interventions to begin with, to get themselves in a position that their hormonal health is likely to be levels likely to be optimized. Again, getting the light at the right time, getting the right levels of sleep, nutrition, those types of things. Now, what if you are in a position where you have actually meticulously done all of those things, yet you're still suffering from, an issue with hormones? How available are other treatments, interventions, pharmacological interventions as an example? How available are they, and how willing are doctors to prescribe such things? What are the risks?
So if we look at, so it is slightly different for women and men, because women have this, midlife loss of hormones, which they absolutely will have, and no amount of lifestyle change will bring back your estrogen and progesterone. They're gone unless you replace them. So more and more doctors are confident at prescribing hormones. It's still, the majority of women don't get HRT or hormone replacement therapy or MHT. So less than 15% of Australian women are in midlife are on MHT or HRT, and more than 25% are on antidepressants. So that shows what drugs people were still more confident in prescribing. But that is changing. And I think sort of social media awareness and, really a grassroots advocacy and awareness and campaigning has really elevated women's understanding of hormonal health. So more and more doctors are more confident at prescribing hormones. For the majority of women, hormone therapy is safe and effective. We use estrogen through the skin, which means it doesn't have a risk of clot or stroke. You can even use it after a heart attack. We use natural progesterone as a tablet, and we have in Australia, we're one of only 3 countries to have a testosterone formulation for women, which is TGA approved. It's only approved for postmenopausal women, but doctors will prescribe it off-label for younger women, and that can be transformational. And yes, it's really important for the lifestyle, but a lot of women find they can start to go to the gym, they can eat better, they can stop drinking, they can sleep, they can reconnect, do their meditation when their hormones are in a better balance. So that's women. So it's getting better. It's still nowhere near where it needs to be. It's still not mandatory in training. It's still not part of medical education. And it's a real, travesty, because it's an opportunity to improve well-being, women's participation in the workforce. These are women who are often leaders in their businesses, companies, whether big or small. And I think we have a huge female representation in our political system at the minute, and I think that's really helping. For men, there's certain conditions in men and women that will mean you have low hormones. So there's certain genetic conditions, and that you may not know about that until you're trying to have a baby, and that might be the first time for men that they discover they have a genetic condition like Klinefelter's and they don't produce testosterone. And then there's some other conditions that mean you have genetically low testosterone, and the only way you're going to get the testosterone up is by giving testosterone back. For men who aren't in that group, who still wish to have a family, it's really important that you work with somebody who knows what they're doing. There are other drugs, there's clomiphene and HCG both can help to stimulate endogenous testosterone production if the testes are working without suppressing your natural testosterone. So that's certainly something men can do. And again, it should be done with somebody, a doctor that knows male hormones, which would be a male and an endocrinologist who specializes in androgen deficiency. So you can support natural testosterone production without impairing fertility by using these other drugs.
Oh,
Really important for men and women to exclude things like sleep apnea. So if you don't sleep properly, you'll not produce enough testosterone. So sometimes just by getting men onto a CPAP machine, their testosterone will come up, addressing metabolic dysfunction like we talked about, building muscle. But for men who have done that or actually don't have the motivation to do it because they're in this low hormone state, that they can't get to the gym, they can't make better food choices because they're flat, they're depressed, especially if they've completed their family, then the risks of testosterone supplementation are actually quite low. There is no good evidence that it increases your risk of prostate cancer. Low testosterone is associated with prostate cancer. Low testosterone is associated with diabetes, dementia, osteoporosis, depression, and low muscle mass. So
I think we got to distinguish between, bodybuilder testosterone, flooding your body with that compared to what we're trying to talk about right here. I think there might be some myths again that come from that idea, don't you think?
Absolutely. A lot of the negative data and research that shows that testosterone is dangerous is related to the synthetic testosterone and sort of more these real anabolic steroids that really bulk you up. And we do need more funding and research into low dose testosterone supplementation in men. I think we need to know, is it a bit more safe than we thought it was? Could it be used a bit more? Because there are a lot of men with low testosterone who maybe just need a little bit just to get them back on track. And sometimes they may be able to come off the testosterone because they have built that extra muscle and now their endogenous testosterone production's gone up. But I think it's critical to understand that risk of infertility. And I think that's why mainstream medicine needs to do this well, so that people are not going to online clinics or getting it off Amazon and potentially putting themselves at risk. So yeah, testosterone is a hormone that really can work well for both men and women. And we don't use estrogen and progesterone routinely in men yet. That's something I think there's some small studies looking, for instance, at estrogen to treat advanced prostate cancer, which is really exciting. And that has much lower side effects than using the drugs they usually use. And they've used progesterone in men for alcohol addiction and PTSD, neglect and smaller others. So yeah, so I think these are hugely underused, under-researched drugs that people can't make enough money out of to really research. So yes, if you've got any listeners that want to do world-changing research, then there's certainly plenty of scope to do amazing things in this area.
So say someone's going in to a GP clinic, they've got their GP, they're citing that there's a lethargy in them, there's kind of a feeling of depression, maybe some of the other symptoms that we've talked about, and what do you want to hear from your GP to know that they're actually thinking about things in the right way? Or what do you need to say to them to prompt them perhaps? Or what GP do we need to go and find to actually get us in a situation, where these things are looked at? Because I kind of guessing here, but I'm not sure that, if you go to your local GP and you sort of say, I'm feeling lethargic and a bit depressed, they might get out the checklist of questions to ask you, but I don't know if about mental health, but I don't know if they're going to go down the hormone route.
Yeah, I think that's really true. I think so. Certainly, I think everybody should be asking for their testosterone levels to be checked. I think I routinely check that for both male and female patients. And it is useful to see, is it sitting low? I think partly I like to watch and see. It doesn't mean I'm always going to prescribe testosterone, but I think it's really interesting. And for women, particularly, and women in perimenopause, their other hormones fluctuate wildly from day to day. So perimenopause is a clinical diagnosis, so hormone levels don't actually help. So for a woman who thinks she might be in perimenopause, that's when you're still having, a menstrual cycle, then a lot of the diagnosis is by listening to your story. So it's really useful for women to go in with really a list of symptoms or already having downloaded a health report and here's all the symptoms I've got. I think it is perimenopause, doctor. and really you don't expect the doctor to pick it up. And what we tend to do for women is we're often ruling out other causes, like an underactive thyroid or anemia or something else. But we can simultaneously treat you for the symptoms that you've got using hormone therapy as appropriate. With men, you will need to. I think most men would need to ask their GP to check their testosterone, and you will also need to check there's pituitary hormones as well, the FSH and LH, and sometimes we do DHEA as well, and estrogen to check it's not converting too much. And then it really depends on the GP. It is very restricted in terms of testosterone prescribing for men. It's actually harder than it is for women. And it is, if you want to get it on the PBS, the cheap drug system, you do need to be referred to an endocrinologist.
Mm,
And there are endocrinologists who do have an interest in men's health. There's not a lot of them. We need more,
mm,
because I think if you're doing diabetes medicine, I feel that this should just be another part of, the tools and the treatments on option. So I think as a man and a woman, you have to be very specific and say, I think it's my hormones. I need to have them checked, or I need to have them considered, depending on where you're at in life. And if the GP is not confident, which, to be fair to us, we've not been trained, then asking for a referral to somebody who does know more about women's health or men's health, because I'm not taking no for an answer, really exploring it properly.
yeah, absolutely. I think there's a lot on the line, so I think it's worthwhile really pushing that. So what are the examples that you might have of people that you've come across that have absolutely completely changed their lives as a result of this? Have you got any examples that come to mind, or one example that comes to mind where?
Yes, so many. I mean, one of the stories that I've got permission to sort of tell is a woman that I first saw, I think, 8 years ago, and she came with all of these weird symptoms. She had, well, they're not weird in retrospect, but they felt weird at the time.
Yeah, yeah.
She'd seen, and then by the time she saw me, she'd already seen 6 specialists and had a couple of hospital admissions. She had insomnia, anxiety, overwhelming fatigue, and she had electric shock feelings all over her body, and nobody could work out what was wrong with her, and she was on a low dose antidepressant. And she didn't come very often. She sadly got divorced, but she was quite ambivalent about it. And then she came back in 2022 after I'd done a lot of hormone work, and I was reading her notes. And before she came in, so obvious. And this time it was easy. She had hot sweats and night sweats and hot flushes, which most doctors will recognize as a menopausal symptom. But she still had a regular menstrual cycle, and we've always been taught that is, you can't have a regular menstrual cycle and be perimenopausal, which is absolutely untrue. And I said, I think you're perimenopausal. And she said, yes, that sounds right. So she goes, most women in my family have gone into menopause really young. She was only in her early 40s at this point. And I was thinking it would have been good if you'd mentioned that before, but I guess it's my job as the doctor to ask the right questions. And we started her on some hormone therapy, and 3 weeks later, she said she felt the best she'd done in years. And then we added in some testosterone, and within a year, she was completely back to her own self. But she'd lost 7 years of her life by that point. So she hadn't been able to work. She'd got divorced, and her children hadn't had a functioning mother at home. So, this failure to consider hormones has huge ripple effect, both economically and, in terms of society, and destabilizing family units. And in terms of the best story with a man, I've got one chap, and again, I have to be careful not to reveal any identities, but he had other health conditions going on, which often run alongside low testosterone, such as diabetes and sleep apnea. But he really worked on all of those things, but couldn't really get his mojo, his drive back. It's not just about sex drive, it's just that kind of drive for life. And by adding in really quite a small dose of testosterone, he suddenly just was back on it. He's organized. He was able to work again. He was able to go to the gym 5 times a week and lift weights, and be able to get into a new relationship. So really, and then that helps those metabolic issues as well. So it, when it's done well, it's transformational medicine. There isn't any other drug that you can use that you see people say, I've got myself back. And that's all we kind of want. It doesn't have to be.
just sounds so transformational. I mean, the whole mental health epidemic that we have and all of that, like, it seems to affect so many things from sleep to wanting to even exercise. The whole lot of it, the bit of the chicken and the egg going on there. But
Yeah, one of the best descriptions is somebody said, like it's literally like you've gone in Dorothy and the Wizard of Oz from the black and white to the color. So it's literally like the technicolor has come back into your life. And hormones don't fix everything and they don't fix everybody. So I don't want to make it sound like it's always a magic solution, but for a significant number of people, it is. So it's an amazing tool to have in our medical kit for people who are experiencing symptoms of low or very fluctuating hormones.
No, Ceri, you're doing great work here, because honestly, I think it's okay to be overstated when the world seems to be understated in an area that is so fundamental. So I completely understand. And I'm really hoping that people get a lot from this episode. I'm getting a heap out of it. I will certainly look out for any of the signs as I traverse the yeah, my 20s. That's right. Thank you. I appreciate that. And so, people take for granted their health. We all do, right? The question that I am wanting to ask every single guest on this season is that if you could only, and I hope you have many more years of good health, but if you could only have 1 year of good health, what is it that you would do with it?
Oh, you could have prepped me for that one. Um, it would definitely involve, actually, I can tell you, I think I would travel the world with my family and I'd try and climb, probably not the highest peaks. If I had no training, I probably couldn't do the 7 highest peaks in the world, but I would probably travel the world climbing really big mountain.
Oh, that's cool. So you seem super active, so I imagine
Yeah.
right on brand for you.
Yeah, I think I would choose like maybe not the highest peak. It was some continents I could probably do. I could probably do the one in South America. I think that's 𝐂𝐞𝐫𝐢, is it? And then Kilimanjaro. I could do those. Everest might be a bit past me. I might have to do one of the smaller Himalayas, and maybe some small ones in the UK. But yeah, no, I would do that. It definitely would involve being outside in nature, and exercising. And I do laugh, we spend so much of our time, and I'm the same, working in these offices. I love my job, which lots of people do, but you do spend a lot of your waking time working to have the money and the time to really do the things you like.
Yeah.
And I think we have to be really careful to maintain, to get the balance in those priorities. We do need to work, but really making sure that you don't miss out while you're young and healthy on really enjoying, what's free outside.
Yeah, and I suppose everything that we've been talking about today is about making sure that people have the capacity to make good decisions and think strategically and think about taking time away and all of those types of things. And one can do so when one is healthy.
Exactly. If you're in the depths of depression, you can't make any decisions. And, mood disorders, I'm lucky I've never experienced it, but it's like the worst pain ever because it's in your brain. You cannot escape it. You've got a sore leg, you can get a bit of distance and you can see that it's your leg. If you've got a depressive mood disorder or you're feeling suicidal, it is the worst pain ever. And for some of those people, we could be using hormones to help. And I think it's a terrible tragedy in medicine that we have not been using that when we know it works, and we've known it works for decades.
Yeah. Look, thanks for your amazing work. And I'm looking forward to continuing this conversation on socials afterwards, because we've had a lot of pre-chat and I'm sure it's going to happen post this as well. I'm hoping that people listen to this and actually make some changes in their lives, preventative potentially, and also are a little bit more aware of what to look out for and what to say to their GPs if they're having some concerns or issues. So again, thank you so much for taking the time. It's been an absolute pleasure. And I think you should definitely go and climb those mountains regardless.
I think that's a great idea. In fact, I'm not taking the family. I'm just going to go on my own.
Good on you. Appreciate it.
Thank you so much for having me. Thank you.
No worries.
If you have resonated in any way with the sentiments of this podcast, we would be delighted to direct you to our website, www.itsneveraboutmoney.com.au, for more free resources and education aimed at improving your capacity to make sound financial decisions for the benefit of your family. We wish you every success, however you define it.